Hey, Aisha, Islam, how are you?
Alaikum salam. I'm great. Good to see you.
Yeah, it's great to have you on the Purpose, Passion, and Profession podcast. So, for all of our listeners, this is my friend Ayesha Akhtar. She is an old friend. We have not seen each other in a while, but I like following you, Ayesha, on social media because, in addition to all your professional pursuits, I have a special place in my heart for athletes. And,
Ah,
I know that you are a marathon runner and, and we'll talk about that kind of stuff near the
sure.
end of the conversation. So I enjoy hearing about all the races that you run and
Well,
stuff like that.
thank you. It's such an honor to be here. So thanks for inviting me.
Yeah, no, I'm glad we were able to carve out time. So when we first met, probably in the late 90s or early 2000s, I knew Aisha as a certified public
Yeah.
accountant. And today, as I look at your LinkedIn profile, I read that you are a health equity strategist and a public health and policy leader. And it also has the CPA in the title there.
Yeah.
Tell me about what you're doing now.
Yeah. Yeah. The pivotal moment to get to where I am now was essentially reading The Alchemist. Have you read it?
I want to show you something.
There you go.
I
There
love
you
this
go.
book,
It's the
and
best.
I heard you talk about this
Oh,
on another podcast, and I said,
love it.
"There's another reason why this person is like a
Oh.
kindred soul."
Oh, isn't it the greatest? I read it in one sitting and I got up and I was like, oh my God, I cannot do taxes for the rest of my life. And at that moment, my projects were creating tax shelters in the Caribbean for Motorola. And, I just couldn't really wrap my brain around that and that was something that I really wanted to do. So I knew I didn't want to do blood, can't deal with that. Didn't want to go into medicine like my family. And so public health is where I landed and just really fell in love with the idea of public health, preventative education, and health promotion, and really kind of understanding why people get sick in the first place. And so I went to grad school, got my master's in public health, finished grad school, and co founded Heart Women and Girls, which still exists today. I did that for a few years and then landed a job at the Epilepsy Foundation, which is where I am now, 14 years later, having zero connection to epilepsy, not knowing anything about it, just kind of threw myself into this work as a part time educator. I would go into classrooms and teach seizure first aid. So schools would call us and they would say, hey, we had a student that had a seizure. Could you come in and do a training? And I would go in and it was very reactive. I did that for a few years in that way. And then I kind of realized that, wait a second, I'm in public health. Like I should bring the proactive part of this education to the classroom and started changing the way I talked. I started talking about the brain in general, and anyone with the brain can have a seizure, and kind of just tried to connect with my audience in a different way. And I did that. I did that for several years. And then in 2019, I started to write some legislation, co-wrote the Seizure Smart School Act with our lobbyist, and that went into law in 2020. And so basically, seizure first aid is now mandatory in all Illinois public schools for grades K through 12, which is really fun because I have so many teacher friends that will call me or text me and say, I just saw your video, or I have to take this training because of you. And it's great. And it's great. And so that's where I'm at now. And then in 22, I kind of did a rebrand of myself as a person and really wanted to be very intentional about health equity. And that's when I really dove into health equity and changed the way I approach my work. And that's where I am now.
And it looks like you also made another evolution and going back into or going into teaching as well.
Yes. Yes. This fall, it was the first time I had entered the college classroom. It was really exciting. I became an adjunct professor at University of Illinois Chicago, where I got my master's. So it was really awesome to go back into the undergrad program where basically I'm connecting with students my own son's age, which is wild. But yeah, that was an amazing experience to really come full circle and be able to teach a class on health systems, health policy.
That's
Yeah.
exciting. So you started out studying accounting at Loyola.
Yes, correct.
And then what was it about public health that, first attracted you? Because you went and got a master's degree in public health, also at, University of Illinois, Chicago.
Yes.
What was it that put you in that direction?
Yes. I think for me, it was being around, my husband's grandparents at the time, grandmother. I remember she would be admitted into the hospital a few times in a row. And just something in me was like, well, why does she keep getting admitted in the first place? And why can't we just like look into the preventative part? And I didn't know at that time that that was called public health. I just kept diving deeper and asking why. And that actually is public health, like the looking upstream, keep pressing up to see what the solutions are, what the root causes are. Once I learned that that was public health, I was like, okay, that's it. I'm leaving accounting. That's it. I know this is where I need to go.
I learned about public health without knowing that I was thinking about public health also. Like, I come from a law background, and, I was a public defender for a long time. I always thought, and we talked about this in our office, that, when we would advocate for our clients, we would say, "Look, you wanna throw the book at our clients, but really, it's something that is systemic. If
Yep.
we can go to the root causes of, what causes these individuals to engage
Yeah.
in the criminal justice system, we could really make some amazing changes." Because there were times where, not me personally, but people in our office, we would have a client who was part of the system because their mother and father were actually our clients, in an abuse
Mm,
and neglect situation. And the
wow.
public guardian would be representing
Yeah.
that child. And then, but 7 years later, that would be a juvenile, and we would be representing her or him
Wow.
in juvenile court. And then fast forward, another 10 years, they might be back in abuse and neglect court as the parent, or in criminal court. And there
Wow.
was nothing unique about these
Yeah.
individuals. I mean, they're not inherently bad people. It's something about the environment. And then I stopped litigating, and I went to work in a public policy shop, and they talked about, what you said, upstream,
Yes.
and, you know, primary prevention and
Yes.
secondary and tertiary. And, I also was like, "Oh, this is awesome."
This is good. It feels good. Yeah,
Yeah.
and what you're describing are what, the social drivers of health, social determinants of health. What you were describing is that built environment that a person is kind of born into, right? Sometimes that you might have heard people say that your zip code determines your health outcomes. So in Chicago, between Streeterville and let's say 10 L stops west off the Green Line. I live off the Green Line. Do you want to guess what the gap is in years, life expectancy?
I'm gonna assume it's huge.
It's like 14 years.
Wow.
Yeah, just
That's
based on
amazing.
zip code. Yeah, yeah. And so that's the kind of work that, like, I wake up in the morning and I'm like, "Okay, that's the kind of work I wanna do."
So you're at the Epilepsy Foundation, and,
Mhm.
your position there now is VP of Health Equity, Education, and Advocacy. So, on the education piece, what is your day-to-day work involve?
Yeah, so it's funny when we wrote the law in 2020, I thought I was going to be really busy. I'm a department of, well, now I'm 3 people, but at the time it was just 1.5 persons. I thought I was going to start getting really busy, so I started trying to amass a bunch of little minions, Ayesha minions, and volunteers who would go out into the community. But what ended up happening is the Illinois Principals Association called me up to actually formally record my training. So now my training is available online for teachers. So where I thought I would be so busy, teachers are actually just like accessing things online. So I'm not really, so I guess it's very successful in that regard. The training
Great.
speaks for itself. But so what other things I can dive into are virtual education for patients. So all of the unmet needs, I like to look at those and try to come up with education sessions. I have a medical advisory council that I manage, and so those are nurses, pharmacists, epileptologists. An epileptologist is a neurologist who has an additional training in just epilepsy. So I curate topics, curate agendas, curate roundtables to just kind of address public health issues. So, like last year, for example, I hosted one and it was called Access to Care. And I had the most random panel because I like doing things in a very different way. I also believe that when you mix up the room, you get better answers. If you have the same people in the room, you get the same conversation. So I had my former when I was in grad school, I was working at a I was working for someone who now works at the Midwest Asian Health Association. So she's the executive director there. And then I had a couple of people from Lurie Children's, and then I had someone from FQHC, a federally qualified health center. So I had everyone up on the panel, and I had them all answer the question, how do you address the barrier of access to care? And the woman from Maha, she said that because mental health, depression is such a stigma in the Chinese community, they would have free massage days. So they'd invite the community to come in, everyone got a 20-minute massage, and then they would administer the PQ2, which is like just a quiet little questionnaire screening for depression. And if anyone got red flagged, they would quietly just get moved to a different room. And if not, then they would be going on their way. And that was their way of just kind of addressing that need and that stigma and that access to care. And everyone in the room was like, what? That's an amazing idea. So when I saw that happen, I wanted to do more. So I try to build more of those kinds of roundtables.
Now, is that going to then be the health equity piece, like to create more equity around the issue of epilepsy in
Yes.
our communities?
Yes. So the way that shows up every day, for example, our office in Chicago, we are technically responsible to serve 44 counties in Illinois.
Okay,
And
that's a
Illinois,
lot.
it's a lot. And Illinois has 102, as you know. And there's no way we are physically in those counties. So we are looking at ways through the Chicago Health Atlas, for example, which is an amazing tool that, like, if you like to go down rabbit holes, that's a good one to go down. If
So
you
tell me
like,
what that is.
mm. So you can look at any health indicator. Let's say you want to look at childhood asthma on a certain zip code for a certain ethnicity. You can find that data. And so a few years ago, I was on there looking for epilepsy data and seizure data, and I wasn't able to find any. And then I connected with the lead epidemiologist at Cook County Department of Public Health, and I actually gave her all of the ICD codes. So those are the billing codes. I gave her like a list of maybe 40 billing codes for epilepsy. And I begged her, I said, could you please put them into your database? Because I know there's epilepsy and seizures popping up in parts of the city of Chicago where you're not tracking. So she finally agreed. And like 8 months later, she wrote me the most beautiful email. It said, dear Aisha, you were right. Look at all of the disparities in the south side of Chicago. And so that data helps us look at what we have to do next. So we now know that in Black and Brown communities, for example, like Ingalls Hospital, we know that people are using the ER as a primary care provider. And so through a health equity lens, we build education. So then my team goes in and we do education for nurses. We connect pharma companies with resources on site at the hospitals. And so we try to replicate that everywhere we go.
Um, what kind of challenges do you find in addressing some of these issues? Because you're talking about, for example, the Angles Hospital. People are using the ER as a primary care, which is
Hmm.
very costly. It's inefficient.
Hmm.
Um,
Hmm.
uh, what kind of barriers do you find in trying to, you know, change that?
Yeah, huge barriers. And I think to answer that, I'd love to step back just for a second because I think one of the biggest issues that I have found is that I don't have a lived experience of epilepsy. So I can't tell someone what the day to day is like, but I know from experience of working in the field for 14 years. And one challenge is to make that relatable and make that important. Like I had to beg that epidemiologist to please just trust me. I know that this is of value. Let's get the data in there. So that's number one is just getting people to believe in the cause. And then number two was something I learned in grad school, which is the so what. Like if you have an idea and you bring it to fruition, you always have to be able to answer the question, so what? Like what happens if we don't do this? So if we don't bring so what ended up happening is we were able to connect with a pharma company that provides rescue medications for people with epilepsy. So not everyone needs to go to the ER. You can actually just use a rescue medication. but the hospital didn't have access to that. But I have access. Like I know the number, I can connect the pharma. So I connected the pharma with the nurse and boom. Now every patient who when they leave, they are going home with the rescue medication. So it was a little bit of like lending my credibility and I'm just kind of getting into my network of people that I know and I creating a gold standard. So I feel like number 1 would be getting people to connect to your vision, and number 2 is just really looking into the network of who I know and what is the gold standard that we're trying to create.
Okay. So one thing that you mentioned that I want to pick up on is that you don't have the lived experience.
Right.
You don't suffer from epilepsy. One thing that I hear a lot from even my own kids and then other young people that I mentor is I don't have a passion for that. That's not really what I'm passionate about. But it sounds to me like when you were even transitioning from the business world to the public health world, you didn't say, "Oh, my passion is to address the public health issues surrounding epilepsy." And
Right.
yet it sounds to me like you are very passionate about it now. Is that
Yeah.
fair to say?
Yeah, 100%, and I would tell that to any student as well, that, like, do not go with blinders on. I could have never predicted that 14 like, I've written a white paper, I've written a law, like, there's so many things that I've done in the world of epilepsy that I never thought I would have, but it's because I really believed in approaching my work through a health equity lens, through a public health lens, because those are the lenses that I love. Those are the things that I enjoy, so I can bring that skill set. I could do that for diabetes. I could be able, I've done it for South Asian health. So, as long as your skill set is there, it should be applicable to anything.
And I tell kids that, you think you don't have a passion for something, but sometimes when you get really good at something, that joy
Mhm.
evolves and comes out of becoming really good or even an expert. Do you feel do you agree with that?
Yeah, I do agree with that. And I think for me, as soon as you said that, it reminded me of the sort of rebranding I did on myself in 2022, where I dove into masterclass. I learned all these things about creating your own brand, being your own person, and like, what is my personal mission statement? And this is like when I mentor students, this is one of the first things I ask them as well is like, what is your personal mission statement? Like, what do you want to do every single day? And so many of them are just like, I don't know. I've never been asked that question. And so here I am to ask that question. It's really important.
Have you read any of the stuff by Dory Clark?
No.
Okay, I'm gonna send you a couple. Like she is a journalist turned political campaign strategist turned self-branding marketing like consultant, and she's written a bunch of books. And I've read them because I've tried to like think about how young people can kind of evolve in their
Yeah.
careers rather than just staying in, whatever typecast, undergraduate degree or graduate school degree they got. So Dory
Yeah.
Clark is somebody
I
that,
will definitely. Yeah.
yeah, I'll
Thank you.
share that with you.
And you know what, Janae, also, like, I went to grad school when my kids were little. I was on the floor playing with them, studying, and they came to my graduation, and for me, that was so important for them to see that I could change careers and then I could just do something else, and now they see me, like, developing a side business and consulting, and so I want that. A lot of times, that is my reason. I want them to see that you have to continuously evolve. The world changes.
And when you first got into the public health world, you talked about heart, women, and girls. And so that was a very entrepreneurial, service oriented activity. Can you talk a little bit about that and what that was and what it continues to do and how that helped you transition into this arena?
Sure. So Heart actually started from my grad school policy class, which is wild, because now I teach policy. So I wrote a policy action plan, and my friend Nadia Mohadra, I'm sure you know Nadia. Yep.
Mhm.
So she and I at the time we thought, well, why don't we just put a 1 day women and girls workshop together, everything on um, like your period to like fasting during Ramadan, like how to like just anything related to girls. And we did this one day thing. We got funding from the Office of Women's Health, and it was just like a grad school thing. And it was so successful. People that day asked us, "When are you doing the next session?" And we just looked at each other like, "This is just a one-day thing. Sorry." But that's what we realized, that we were really filling a void on creating a safe space for women, Muslim women and girls, to have conversations about reproductive health. And so that's what Heart exists today, to fill that void. So
So
through that process, I mean, we learned everything: how to incorporate, how to find lawyers, how to build a board, what is our bylaws, and what isn't our bylaws, like what is a good thing to do, what is not a good thing to do. Like sometimes you just have to know like what you're not, so you know who you are. And there's so many iterative conversations about just building that brand.
and the well, I'll make one comment about Heart. I remember when you guys formally launched. I don't know if I knew about the initial training that you did, but I do remember the initial launch and within the Muslim community. You guys were talking about like reproductive health and sexuality and things like that, and I was like, that is gutsy
I
to do
know. Yeah.
like, the Muslim community, but very important, and I'm glad you guys did it, but that was my initial instinct was, "Wow, this is
Yeah.
really gutsy," and I'm just cringing for, like, the uncle,
Yes.
like, reactions.
Yeah. Oh, there were a few. There were a few. Yeah, and Heart just celebrated its 15th year, so it's doing wonderful.
That's awesome, that's
Yeah.
awesome.
Yeah.
So, did you find that the experience of starting that kind of an organization that does that kind of work gave you skills that you could, you take your education, your master's degree, you take this organization, and did the combination of those 2 things then help you move along in your career as you moved, forward?
Yeah. I mean, even to go further back, my accounting degree, like, set me apart in grad school. I had a couple of professors, especially in my econ class, they were like, "You're a unicorn. Nobody comes to grad school with a business, like, you have a BBA, you're a CPA, like, that's so unheard of." And, so that's when I kinda realized, like, "Oh, I guess I'm kinda different. This is kinda cool." And then, yeah, that all of those skills helped me found this nonprofit. And then being in the nonprofit, it's helped me in my day-to-day job because I understand, lots of times people have this kind of crunchy view of nonprofits. They think that like, everything's great and you're solving the world's problems, but you're still running a business at the end of the day. You still have a budget and you still have to come within your budget. And so it's really important to be able to have that skill set. And so I think that all of those things combined. I mean, I don't regret for a second having my business degree. I think that I like the path that I took. I think it's awesome. So even for young students who I mentor now in public health, when they say, "What should I do?" The first thing I ask is, "Well, do you have any business skills?" Because you need business skills. You need to know how to write a budget, how to write a proposal, how to write a grant, how to evaluate a grant. And thankfully, between my education and my job, I was able to get all of that.
So now you are you're talking about doing some entrepreneurial things, new entrepreneurial things. Can you talk a little bit about that? Is that
Sure.
cool?
Yeah, I can talk a little. Yeah, I'm consulting for a friend of mine who is launching a business. It's a digital healthcare startup, and he's trying to bring to market commercializing the community healthcare worker. Are you familiar with that? Okay.
I learned it from you on another
Okay. All
podcast.
right. Yes. Oh, yeah. So the community health worker in the whole model of the healthcare system, they're often considered the lowest rung in the public health totem pole. But those are the people that will go day to day, everywhere. Did you take your medicine? Do you need diabetes education? We're going to do a nutrition seminar. Like they are really just door to door folks. And so there's evidence to support that working with the CHW can improve your patient outcomes. And I actually had a grant many years ago where I also demonstrated this in the epilepsy space. And those are the people like, at the end of your doctor's visit, they sit with you and they say, "Okay, what did you hear in your visit? Like what are you going to do next?" And they walk through that. And just think about if you have a very difficult visit with your provider and you have someone who kind of does your checkout with you, make sure that you're in line with everything, you understand, you're going to definitely have better outcomes. So his idea is to bring that to market at the employer level and have an app for employees to use as a benefit. So the CHW will kind of work with the employee hand in hand to kind of navigate through their health journey to improve their overall vitality and wellness. So I'm providing some consulting for him on just kind of like the public health language and the health equity lens to do that work.
That's awesome. And, is this gonna be, a kind of consulting service that you're going to be, making available to others? So the business is consulting, leveraging your experience and knowledge.
Correct. Exactly.
That's
Yeah.
exciting. And, is it formally launched, or is this more like just like a soft launch at this point?
It's launching. I believe he's in the pre-seed round of funding, so he's running on that side, and I'm kind of running on this side, doing some of the public health work.
Oh, that's exciting. Well,
Yeah,
good
it's
luck
really
with that.
exciting. Thank you. Yeah,
Now, I saw something really interesting on your LinkedIn. I've never seen it before. Like I feel like we're kindred souls in our commitment to mentoring. You're very eager to mentor people. I tell, mostly the people that I mentor are college students that want to go to law school, law students, or younger lawyers. The
mhm.
lawyers, that have less experience than me, which at this juncture is
Yeah,
the majority of them. But I saw something on your LinkedIn. You actually will let people make an appointment with you for like a 30-minute mentoring session?
sure do, and people sign up.
No, I would imagine they would. But
Yeah,
tell me about how
yeah.
that came up and how that's going.
It's so great. It's not a heavy lift. It happened very organically where someone reached out to me and they said, "Hey, can you talk to my daughter? She's interested in public health." Yeah, sure. And then it happened again, just like organically here and there. And I thought, well, this is actually something, and it's really important for me. I still feel like I get something out of it because I get to talk about what I do. And as you know, it's so important. You're in the public eye, it's so important to have like a 30-second elevator pitch about who you are and what you do. And that's part of your brand. And so it kept me honest about my brand. And so I enjoy it. And so then, yeah, I just set up office hours on Fridays. I think it's like every other, I don't even remember how often it is, but I feel like it's every other Friday. And when people sign up, I've had people come call me from Dubai, from Ireland, I mean, from all over. It's been really fun, and the one from Dubai was really interesting because she was a public health student and was also she was in public health school, but she was previously a vet. And she's like, "Is there like, what would I do?" And I was like, "Oh my gosh, do you know, like, you are a unicorn because no one has that combination, and you could talk about keeping your pets healthy, which then keeps your families healthy, and, like, you could do education seminars," and she was just so excited. So that's what I love to see when I do the mentoring. It's just watching people's ideas.
No, that's really exciting. Now, I wanna ask you about the challenge that that creates, though, because, you're probably rare in making yourself so available to mentor. What I found is that, there are a lot of people that are willing to mentor, in their field
Yeah.
when people ask them, but they don't
Yes.
necessarily put themselves out there
Yeah.
as available. So, when somebody like you puts herself out there, how do you manage not getting overextended?
Yeah. I really am glad you said that because I mentor people in the way I wish I was mentored. And I wish that there was someone who was like low hanging fruit that I could go to. There was no person like me, no one that I could look up to. And so that also drives me to do what I do. And so, I mean, I'm the person, like, I will sit on my Zoom like 5 minutes before and I'll wait for someone to get on. Like, I get excited. So I try not, there have been times, yes, I've had to reschedule and rearrange. But I think keeping it every other Friday, I think just me managing my schedule has been worthwhile, but also just reminding myself that I'm getting something out of this too. So it's not just one directional. I think that's what also keeps me grounded.
And once you develop contact through the mentoring, do you continue to stay in touch with those individuals if they want to?
If th Yeah. Yeah, I do ask them. I always tell them, "Check back in with me in about 6 months, 8 months. I would love to hear, how you're doing," kind of thing. So I leave it up to them. I didn't I haven't decided if I want to be the one that's kind of going after them, but I feel like it's probably their responsibility to check back in. The door is
No,
open.
absolutely.
Yeah.
I go to law student conferences
Nice.
and then I speak and then like I give out my business card. I tell law students, connect with me on LinkedIn. We had a nice
Mhm.
conversation here. Connect with me on LinkedIn. And they do. And then I never hear from them again. And I like try to make posts on LinkedIn saying, I'm glad that you all connected with me. I've got
Mm.
like 100 law students that are probably not law students anymore,
Gosh. Yeah.
in my network. But if you meet me today and then you aren't available, you don't tell me what's going on for 5 years,
Mhm.
and then you come back to me 5 years later, we don't really have a relationship.
Yeah. Yeah. I agree. One of my students this semester, one of the assignments I had them do was a site visit because I think it's very important for students to learn how organizations work. I even walked through a 990 with them. I mean, I show them everything. So I was actually presenting at a conference in DC, so I wasn't able to be in class a specific day. So I knew that that day we would do the site visits, and I made them all virtual, so it was super easy. And so I set up 4 different site visits, um, 4 different organizations, and they were just going to learn about the organization, and they had questions, and then they were supposed to write an executive summary. So one student came up to me and she's like, I really have a passion for incarcerated youth. Can I interview someone else? I said, sure, that's fine. And she said that that was the biggest moment for her in the class where she learned that she could actually just go up to someone and ask them questions. So I don't know if it's something in this generation that maybe students don't realize, like, we're out here. Please come to us. Like, we are asking you to come ask us questions. We want to do that. But maybe there's a little bit of intimidation.
Yeah. I don't know what it is, but I will also tell you, I referred you to somebody,
Good.
to my
Awesome.
daughter,
Oh, good. Fun.
but she didn't take me up on it. When she was she's out of college now, but I had told her, I said, listen, you need to reach out to this friend of mine and I will call her and set it up. And I said, like, what you do. And I said, like, this is a person who, is doing like amazing stuff in her professional life, but then is also an athlete that like takes her athletics seriously. This is what you need to model. And I said, I'll set it up for you. And
Aw,
they said, okay. And then it never
it
happened.
never
And
happened. Oh, darn.
you can't force it,
Yeah.
you can't
Yeah.
force it.
Yeah.
So
Yeah.
I had tried to get you
That's
a
nice.
mentee once.
Aw, thank you. I appreciate that.
So I want to segue into something that I think is probably just as important as our professional lives, and it's your passions on the fun side. And
Yeah.
I see in the
Yeah,
background
there's a
all the
bunch of
bibs
stuff.
and the
Yeah, yeah, and then the majors, they have their own frames. So
oh,
there's 6
nice. What
majors.
is
Well,
that
actually,
one?
now there's 7. This one's London, which I've done twice, and
Okay,
then I have Boston here, I have Tokyo, New York, Chicago. Berlin is left, so Berlin is next September, and then
okay.
I'll
So
get, like, a big medal for all 6 majors.
so for the people that are listening to this that don't know, because we're talking inside baseball right now,
Yeah.
Aisha is a marathon runner. So these are all marathons that you've run.
Yeah, these are the marathons, and I think behind me, yeah, those are some of the marathon medals and then a bunch of half marathons, and I did Ragnar. Did you ever do Ragnar?
I've never done Ragnar, but I
Yep.
know what Ragnar is.
Yeah, so Ragnar, for those who don't know, it's a 200-mile relay race that you do with a bunch of friends, or they will become your friends, and over 2 days. Yeah. Then my team
How
came
many
in
times have you
first
done
place
it?
twice.
Twice. And
Yeah.
then, are there certain marathons that you just consistently do? Like Chicago, do you just run it because it's in your hometown?
Yeah, so you sound like my friends who are like, "Why don't you run it? It's in your backyard."
Hmm.
I've done that one 3 times, but, I think because it's in my backyard, I'm just like, I think I've done that." I've done New York twice. London has been my favorite. It was my best marathon and also my worst. So, I've done it twice, and then Tokyo was pretty cool, but, Japan is amazing anyway. But everyone says that Berlin will be the best, so we'll see, I don't know. And then there's Sydney. That's a new one that they've added to the mix. So, I guess to answer your question, I don't really do one repeatedly. Somehow Chicago just ended up that way.
I just thought it would be a training run.
I know, I know. I'm a really good spectator, though. Very, very good spectator, and so I can spectate really well in Chicago because I know all the corners and everything, so that's fun for me.
So how many do you run per year?
Well,
How many
now
marathons?
I've done 11, so now I'm down to 1 a year, so earlier this year I did London, but there was
Okay.
a time where I did 3 in 12 months, and that was nuts. That was also when I was still competing in CrossFit, so there were a lot of things going on. So I had to, like, stop doing all that. It was crazy.
Yeah, because I saw you hitting some deadlift PRs back in the day.
Mhm. Mhm.
You're
Yeah,
still doing
yeah.
that?
Yeah, I've kind of transitioned, well, I shouldn't say transition because I love, love, love deadlifts still to this day, and I still wanna hit 250. My PR was 245, so I'm very, very close. Um, but I actually went back into playing tennis. I played competitively in high school, and then I tore my rotator cuff because I
Oh.
was trying to copy, Gabby Sabatini, and so now it's been rehabbed and I can play again. So, trying to get back into tennis. So it's just so hard to manage, right? It's like you have tennis, you have CrossFit, you have running, and then I added Pilates so I could actually touch my toes. Like, it's just like, how do you do all this?
Well, I think that for people that are listening that, are even in their 30s and are working full time, they're gonna look at that and kind of be blown away because they're thinking, and I'll tell you what they're thinking. They're thinking, forget the Pilates, forget the CrossFit,
Yeah.
forget the tennis. You have a full-time job and you train and run marathons. How do you do it? So it's
Yeah.
actually a legitimate question. How do you do it?
Yeah. Yeah, what's the thing that people now talk about, the 5 to 9 before the 9 to 5? So, yeah, I'm one of the early risers. I get up at 5:30, and then I what keeps me committed is having a friend. So, I'm a part of, like, a local running group. You're not gonna ditch your friend, right? You wake up and you're not gonna be the one that's like, "I have to cancel at 5:30 in the morning." So, that's what keeps me going. So every day I'm out there. And in the marathon days when you're training in the summer, the midweek runs are longer, like 10 miles. You have to run a 10 miler on a Wednesday before work. So yeah, that gets really hard and things move around. But one thing, I am like really open about training. So people at my work, they know if I'm training for a marathon, that comes first. Like, I might be late for work because I'm training for a marathon, and I just, that's just who I am. I just feel like if you're honest about your training and people see how important it is to me, then I think they kind of make some space.
Oh, that's awesome.
Yeah.
It's nice
I
to have
can't say
that.
that. Yeah, exactly. It's not like everyone's like that, but it's very, very important to me. Yeah.
So after you run Berlin and you get the medal for the majors, what's next?
Maybe running for fun and not just chasing after medals. Paris would be awesome. I'd love to run the Marrakesh Marathon. Honolulu is on my list. But then really, the tennis keeps calling me, and my coach keeps asking me to join, the teams and stuff. So I don't know if that's something that I want to go back to. Definitely
Uh,
something.
what role does being a competitive athlete play in your professional success, if at all?
Oh, so much. I think when I first started training for marathons, there's so much you learn about just the discipline. First of all, it's the discipline. I love the training. Sometimes I just will train, and I hate race day, but I love the training because of the discipline. So there's that. And then also just knowing that there is going to be an ending. Like, right? So, like, when you're running your 26.2 miles, every mile is getting you closer to something. So sometimes when something in work is draining or difficult, I just kinda go into marathon mode in my brain, and I just know, "Okay, 1 mile at a time, 1 rep at a time, 1 problem at a time, and I'll get through this 1 rep at a time." So that's kinda like how I conquer, whether it's like a heavy training, a run, or just life.
What about, going a little bit beyond 26 miles? Because now they have all these
I
ultras and
know.
different levels of ultras.
That's the dark side. I know. Well, and it's funny because first I said I would never run a marathon, and I was like, "Who would go past 13 miles?" But actually, the majority of my marathons have been for charity, and that brings me so much joy to run for Every Mother Counts. And so, I won't say no because I never thought I would run a marathon. So, the bonus, I think, of ultras are that you get to run slower, and I think you get to eat sandwiches when you're running or something. That's what I've
You can eat
heard.
whatever you want.
That sounds amazing, but, I'm not there. Not there.
No. Alright.
Yeah. What about you?
So, like, there was a time in my 50s where I took up running.
Mhm.
I had not I the only time I've ever run before that was, in high school as a way to
Yeah.
lose weight for wrestling, to make
Sure.
weight.
Yeah, sure.
But, never really ran after that until my 50s, and then I took it up, and I enjoyed it. I got as far as I ran, like, 5 or 6 half marathons,
Good.
and then I trained for do you remember the year there was a year in it's been about 7 or 8 years, where the computer system crashed for the Chicago Marathon registration.
Oh, yeah.
So I that was the that was in when I was right in the height of my running, and I signed up, but the system crashed, and then it was a lottery, and I didn't get it, and so I stopped training. And in August, a friend said, "Hey, somebody dropped out of our charity, whatever. So there's an open registration." And so, I mean, the farthest I had run were like 5 or 6 mile
Oh, no.
runs at the end of August, and I said, Obviously, I will do it."
Yeah.
Which is so dumb,
Oh, that's
and
awesome.
I got as far as 16 miles, like, mid-September, and I hit a I couldn't do
Yeah,
it.
yeah, yeah. Smart decision.
The farthest
Yeah,
I ever ran was 16 miles, but, yeah, I enjoyed it. I don't do it like, I had some knee issues, so I went
yeah,
back to my first love, which is just strength training,
yeah.
and, I'm an avid, I do that all the
That's
time, and
awesome.
that's why I love talking to you about
Yeah,
your athletics is
yeah.
because, for me, I train 5 times, 6 times a week,
Yep,
and it's very important to me.
same.
It's part of my success is being able to do that. I don't do it competitively, I don't, do any competitions, but,
Mhm.
I still love getting in there.
Yeah. No, I like how you said that as part of your success. That's exactly how I feel. That's really good. And I'm also a personal trainer, and one thing that I enjoy is training women who are kind of getting back into fitness. I feel like that's kind of like my sweet spot. There was a woman I worked with once. The first time I met her, she just looked at me and she's like, "Okay, I don't do burpees, I don't do push-ups, I have weak wrists, and I don't do" she named like a bunch of other things, and I just looked at her and I was like, "Okay, nice to meet you too." And we just worked through it all, and then, after like a year and a half or so, I got a text from her one day that said, I found a tire and I brought it to my driveway and I am now flipping tires." I was like, "Okay, this is great. I I have
That's one
finally."
heck of an evolution.
It's one heck of an evolution, but it's just, you know, people like women often don't realize how strong they actually are, like, especially if they have a dog, or like they're carrying a child or a work bag, they're working out with like these 5-pound dumbbells. No, you're stronger than that. Yeah.
No, absolutely. My wife is very conscious about, like, her health, and, she's always tried to stay healthy. She runs, and I tell my daughters all the time, I'm like, "You need to ditch this idea that, feminine means weak.
Yeah.
That's crap."
Yes. Thank you. Thank you. Yeah.
Yeah, so I still haven't convinced them to, like actually accept that and do
Oh,
something about it, but I'm working on it slowly.
that's great. Well, for me, it was like, well, I love traveling, and a lot of times I travel alone, so I need to be able to put my suitcase in the overhead bin.
There you
So,
go.
I need to be able
Yeah.
to do that. Yeah.
So, what kind of advice would you give to young people today, like, that are in college or early in their careers, trying to navigate, to do something that they're passionate about, like in helping other people, like, what advice would you give to them?
Yeah. I would say to get involved in as many things as possible and take classes in a variety of things. I really feel that the friends that you make in life, come from the activities that you love. Like so many of my good friends today are runners, and I've met them all in my running group or at my gym because we share the same values. And that all it just makes everything so much easier and so much better. And so I would tell people to find those activities that they enjoy, whether it's an after school volunteer something, because those are the groups, those are the tribes that you're going to build that are going to take you places on these journeys. And to not edit yourself, until you it's time for editing, right? Like I feel like there's so many things that the young people put limits on themselves. They think, well, I don't know how to do that perfectly, so I'm not going to do that. And then they don't even try. So it's okay to try. It's okay to try. It's good to be wrong. Failure is feedback, as they say. It's not doesn't mean that you did something wrong. Failure is just feedback. Like, okay, what do I have to tweak? What do I have to make it different? And to figure out that statement. What is my personal mission statement? That's the one thing that I would also say.
No, absolutely. Once you know what your purpose is, it makes everything else fall into place. And
Yes.
even when you hit bumps in the road, you know how to navigate them if you
Mhm.
know that you have an overarching purpose or a mission that you're trying to achieve. So
Yeah.
I totally see that.
Yeah.
And you talked about how you spent some time trying to reinvent yourself, retool yourself, and you use masterclass and other resources. So are there any things that you found really helpful that you think other people should look at, just in terms of developing themselves?
Yeah, I would say, taking people out to coffee would be great. Just, pick their brain. Hey, can I take you out to coffee for 30 minutes? I want to ask you about this, or I want to, just get your opinion on this one thing. And writing is just such an easy tool. Obviously, it's great to be consistent because sometimes so many ideas live in our brains, and it's not until we do like a brain dump on paper do we really see kind of like what are we really thinking of. But I would just say like getting to know as many people as possible. Literally just met a young girl yesterday, and I told her the same thing: take the meetings, go to networking events, and know your elevator pitch so that if you do meet someone, you're not nervous, you're not starstruck, or you're not, in a panic mode to be like, I don't know what I'm supposed to say at this moment. No, you should just be able to like work on it and figure out, hi, my name is so and so, and this is what I like to do.
So I think like knowing you, I would not, I would say that you come across as an extrovert. Would you consider yourself that too?
Yes.
And have you always been that way?
I've always been that way. I do have those moments where I hit a wall and I need to go and not talk to anyone. But yeah, more of an extrovert.
Yeah, all of us have
Yeah.
that. I
Right.
consider
Yeah.
myself an extrovert too, but
Yeah.
I need my downtime.
Yes.
Absolutely.
For sure.
Absolutely.
Yeah.
Awesome. Well, for the mentoring, where
Mhm.
can people go to sign up? Is it just through your LinkedIn, or do you have a website or anything like that?
I don't yet have a website. I'm slowly working on that. I've started to set up my Instagram, but I haven't opened it yet. So that's coming. But for now, yes, they're able to go on my LinkedIn, and there's a Calendly link right there.
Yeah, I saw the Calendly link. And is that only available to people who are connected with you, or is that
It
on your
should be.
public profile?
It's on my public profile.
Okay, great.
Yeah,
Well,
yeah.
I encourage people to take advantage of that.
Please do. Thank you.
Yeah. Aisha, thank you very much for taking time today to
Thank
talk to
you.
me. It was a lot of fun.
So good. Thank you so much.
Yeah, you're welcome. Take care. Bye bye.